mask as usual so that people know me. I have noticed we have some visitors. You're welcome, sirs. Okay, so it's just a short topic which we're going to do. It concerns the men because it's the men's conference that we're going to have. So the topic that we have, it's called male circumcision. Male circumcision. We've heard about it several times, but we only talk about the surface. A lot of guys have heard about it. We tell stories about it because we are guys and we feel like we know more while we just know the surface. So we'll go back in time where male circumcision started from. It was actually a tradition. It started as a tradition, and that tradition was from the Bible between God and Abraham. It was a covenant, if we remember, if we do study the Bible. It was a covenant between God and Abraham and the descendants of Abraham to show that if you are circumcised, you are God's people. Chikumbuka is a story, guys. So that circumcision was done 8 days after Mwana Mamuna Abadwa. It was done 8 days after Mwana Mamuna Abadwa. And then Mamshita circumcised so that they symbolize or show that covenant which was between God and Abraham. But fast forward, New Testament was wrote because that was the Old Testament. New Testament was wrote, and then we had Jesus who came to die for us, who cleared all to my traditions to Jamonga, sacrificial yakalam, to kill our sins and the likes. Vinakuwa vasira bonse vijay. Na same na circumcision. At that time, it was no longer counted. As long as you receive God as your Lord and personal Savior, but in our today generation, since it's a time ya Old Testament, in a Peter, or by the time ya Jesus, ya Peter, and then about Africa money in time. About the that male circumcision, ya hospital, yama doctors. It's called the medical male circumcision. And then, when Ango Kanasa Didam tradition, it came to our tribes to say, when the Kutani, Kumuduri, my never guys Muduri. When Ango Maina Mazina, Yosiana, I've heard you some as Makamba Chivemba, Muchivemba, my Kamba Bwans, male circumcision. Kumkanda. Okay. Kumganda, Mr. Taura. Kumkanda. Yeah. Okay. Do we have any different tribes here? Gonna have a different name. Kamurusa katuma kambache kwenda kujuis kwenda juis. So my emphasis about this topic is about how we should follow up on male circumcision. It's a good thing because number one, it's a reducing factor for infections and HIV for us men, and we also reduce chances of giving cervical cancer to the ladies or the women or the wives. You see? So male circumcision is very important that we undergo it so that we can protect ourselves and protect the females as well. So we'll go a bit deep what happens from a male circumcision, because I know some of us here might have not gone for male circumcision and then others have gone. Because Kulikamanta surrounded male circumcision. Kamanta kama vera magays nje. Kumkanda. Unaibera hapo mwema mbekela watu kuduwa hiyo. Uzafa. So Zambia touch pa male circumcision, medical male circumcision yako hospital, the process. Nwanga tu amaizi wako process mwema endela ukaenda kwa hospital clinic. What happens, how the procedure goes beginning from start to the end. Yes, sir.
As for me, what I've noticed is that the first they will give you some pills. I don't know if it's Panadol and Chan, but there are some drugs that Mama pass. Then after that, they will go and inject you. I don't know if it's 5 needles in my section. After that, they'll get, I don't know, to my items, to my razor blade, what, they start cutting. Doing what, so yeah, that's what I know.
Okay. Yes, sir.
First, you wanna put a big, so you want to remove the job.
Okay, utosa bache
Hey,
toroshi.
remember the shit. Ero kufaka account kaja. Kufu bazizile ekazizile wabukulasa nyere kusugulu mai kumbuyo kutoka mzipe pa ero ngati wamafunsa umamu muwa osumamu kamba umamu amu wakulasa mbili ero ngasumamu wakulasa chewolo yali 4 ero wakakulasa izangala chachisumvera vili vonse ndipe mai wajuwa mai pasiri then wakufaka na bandage.
Okay. So during my time when I was doing my attachments for the course receipt, I was given a privilege that I was doing it at a level 1 hospital, and I had the chance of working at the male circumcision department. And then the little knowledge I gained from there was that how it all starts, the process. That's a surgery process. Ukaenda muja, it's operation. So the process, the first thing they'll do is to put you under counseling, because they need to make informed, or let me say, decisions. You need to make decisions that are well informed. You need to get information about it because it's surgery, isn't it? So you undergo counseling. They'll tell you how it's done, how they'll start the process in there, up to the time they'll finish, and then they'll tell you how you're supposed to keep yourself afterwards. It's a process. The hidden process, they'll tell you everything about it. So after the counseling is done, they tell you how it's going to be done. They now take you in the room where they do the procedure from, like the sir has said, that when the bed, they apply some chemicals. Those chemicals are applied there to clean the surface area before they operate on you, so that they clean if there are any infections or any dirty things, they remove them. And then you are injected that numb medication. You said where? That same numb medication. So when they inject that medication, the 5 we said it's in one injection. So they inject, they leave a bit, inject in one needle, not 5, the whole full needles of 5. So they will inject, using one, they inject a bit, so that the place becomes what? Numb there, isn't it? And then after that, now they start cutting. And then the cutting also, it's in 2 ways. There is one which they call for the ring, which has been introduced. And then the other one, it's now the one which they use, those medical blades which they use to cut. It's actually a scissors, the one which they use to cut. And then after the cutting is done, they pay because I've seen some processes whereby during that time you stitch, as they are about to finish, the medication finishes here now. What happens now there? A person complains to say, viva, why? But the pain is not that much. And then as trained medical personnel, they make sure that before that medicine completely finishes from making the person numb, they're supposed to finish what? Stitching up, so that you don't feel pain. By the time about series that you are dressing up, and then that's when now the medicine completely finishes, and then you feel a bit of some pain. It's a bit of some pain. It's not huge amounts of pain. Okay, so I'm talking from experience because I've been there myself. So since I'm better than Sonny to tell you, because it's the men's conference here now. Yeah. So I've been there myself. The experience wasn't that bad, but although I failed to walk, I had intentions of saying after it's done, I'll jump on a bus and then go home. But it was a different scenario. I had to book a cab because the cabin made me feel uncomfortable, and then in the bus it's not that comfortable. And then after that, there's the hidden process. That hidden process, they'll tell you it lasts for how many weeks or months. I'm sure some of us will have some ideas. How many weeks or months is the hidden process?
1 week. I think it's 3 days. days.
Days. 2 weeks. 5 to 10 days. Yes.
I think 3 weeks.
3 weeks. Okay. Yes, sir.
3 weeks actually.
Okay. So they recommend 3 weeks that side. So the healing process, it's like this, huh? When you do the operation or the surgery, the top part of the skin heals fast than the inside part. That's the funny thing about operation. Now that's where the counseling comes in, where they will tell you that side to say you can't have sex in 6 months. But you find guys, 6 months. That's what discourages us from going to male circumcision. But it's actually good in a way that the top part of the skin heals. You even see I'm healed. And then you engage yourself into going to have sex, not knowing that the in part is still hidden, the wound is still catching up and the cells are still hidden there. And then you find yourself now in problems. Because the wound inside is not what? It's not healed. That's how operation works. If I was to be cut my hand here, deep, of course the top part might heal fast, but while inside, the wound is still hidden there. So it's important that we follow that what? That healing process and don't engage in any sexual activities. Actually, when we come back again to the Bible, we are told that sex is meant to be had at the right time with the right person at the right place. What's at the right time? Marriage. Who's the right person? What if you're in marriage and then you go and have it with another person who's not your wife? Is it okay? It's adultery, right?
Because as for me, I haven't done that one. I haven't went to the What process can I? What can I do for me to have access?
Okay. So it's what can you do to have access to medical male circumcision? So at each and every hospital or clinic, they have those services. So when you go there, you go at the reception and then you explain to them, I'm here for medical male circumcision, and then they'll direct you. When they direct you, some hospitals or clinics, they work on different schedules and timetables on when it's done. Yeah. So, I'm coming to you, sir. So you just go there, you explain to them what you want, and then they'll render that service to you. But before they render it, of course, you go under counseling so that you make an informed decision. If you hear what they say, it's not convincing, you can refrain and say, okay, no, I want to do it. But as I started saying, it's important because it does what? It reduces the risk of us guys getting what? Sexually transmitted infections. And then it also does what? It reduces the risk of getting or contacting HIV. And then when it comes to hygiene, because we had talked about how a guy can look clean, I remember in the previous discussion, it also ensures hygiene. Because male circumcision is the cutting of the foreskin, isn't it? And then there is that situation whereby the foreskin moves back and forth, back and forth. So there is a time where if you are not bathing or washing yourself at the foreskin, there is a scenario whereby white things can start appearing there and then you cause urinary infections to yourself, you see. So that's why it's important that each and every person undergoes male circumcision who's a male. Supposed to be a must because it guarantees hygiene. And then there is a time where, as we are growing up, if we are not circumcised, you know, the skin becomes hard to move back and forth, meaning that it will be very hard for you to also clean with water. But if the skin is cut, automatically there it's self-service cleanliness. You see now, as you are bathing, water is just passing by itself there, so it ensures hygiene as well. You've seen. So it's very important. This information is just not for us, but also for our young brothers, our cousins, our brothers who haven't done it yet. So it's very important that each and every person who's a male undergoes this process because it's beneficial to us in a healthy and positive way. I'm taking questions. Yes, sir.
Is it true that male circumcision it improves your sexual stamina.
Okay, I was expecting that question. So there has been this myth around male circumcision. When you are cut, the sizes goes different. When you are cut, the sex stamina is now different. Okay, so the thing about it is that when the foreskin is cut, no size change is there. The size still remains the same scientifically. The size still remains the same because others go there with the intention of saying, if I cut, my penis will become big. You see? So the size still remains the same scientifically. That's what the studies have shown. And then when it comes to sexual stamina, it's about sensitivity. It's not the sexual stamina. So there the people misunderstand it. There's nothing like you have good skills or what. It's about sensitivity. If you have the foreskin, you are highly sensitive. When you are having sexual intercourse, you are highly sensitive because the foreskin is more sensitive when it's there. But when it's cut, the sensitivity is reduced a bit. So that's where you find out that when a person is having sexual intercourse, when they have the foreskin, they'll be able to release fast. But when the foreskin is cut, the person delays in releasing just a bit of some delay. But that's not sexual stamina, it's just sensitivity. It's all about sensitivity. So it's not sexual stamina, it doesn't change anything. Have I answered your question, sir?
Yes.
Okay.
So when is the right season for one to undergo that one?
Okay.
Is it June, October,
Okay, so there is no right time. Any time is the right time. You see now? Because if we look back at how it started, we said it was a tradition in the Bible between Abraham and God. It was a covenant, isn't it? For a male child who was, when the child is born 8 days later, they do what? They circumcise. So let's say the child is born in June, the child is born in October. So it had no right season or right time. So you can go at any time, at any age. Because if we look back, we were told 8 days before the child, after the child is born. So meaning that even 7 years old, 20 years old, they can still go. But the earlier, the better. Because we have situations where we have challenges as guys where when we go under male circumcision, we are told to be drinking a lot of liquids so that it reduces the sexual hormones, so that the penis doesn't erect, to avoid those stitches start growing and having a burst there which might create a wound. So that can only happen if you are at puberty and above, sexual hormones. But if a child is still young and then you take them there, that means that they don't have that kind of difficulty because sexual hormones are not active at that time. So it's better you take young brothers, young kids, they are earlier, rather than when they start growing up and having sexual hormones.
What's the proper way of maintaining it when you have stitches, coach? Or for example, maybe washing it. How can you wash it? Because it's important.
Okay, yeah, so there's also an aspect of how you keep yourself clean after male circumcision. So there is a soap they recommend for you to use when washing the wound, and of course you have to be careful and you have to be tender at it. So the soap which is recommended is Lifebuoy, which is recommended for all operational wounds because it has no chemicals or anything that might cause some damages to the wound. So you are recommended to wash it twice in a day so that the wound heals fast.
One last question. So how can you wash it? Using your hands or something?
You can use your hand because the wound is still a bit fresh at that time, so you can use you get the soap, you apply it with your hand, and then you use your hand. Yes. Yes, Mr. Kizito.
Yes, sir. There's this scenario during the healing process. I've noticed most people don't use their hand. They just put the right one more depth, then they dip their back. So that maybe such laziness, maybe they just get the pain.
Okay, so it depends, but I wouldn't recommend that. As a medical personnel, I wouldn't recommend that. because you might cause some damages. And then there's also that scenario for those who have gone. When you are done with the medical procedure there, they place it facing upwards. And the main reason of putting it like that is because of the blood flow. The blood moves from the top of the body going downwards. So you find out if you just let it be like that, meaning that blood will be going towards the wound, and then you have pressure there where you'll be bleeding all the time. That's why it's made to face up, and then you are put a bandage which will help to hold. And then meaning that when washing it's supposed to face up. So I'm sure the logic there is the dish is down and then you dip. Yeah.
Sorry, but I've seen someone getting that I don't know, okay, that pillow,
yeah.
They are using it. I've seen someone doing that.
Okay.
So is it a proper way of using it, or just maybe
Okay, it was just his own style, but it's still okay because it's in replacement of the chisaka you use when bathing, huh? So it's just in replacement of that. Yes. Yes.
And for me, okay. It's just a comment. When you go for circumcision, of course, you are going to hear different stories. The penis does that. By the way, I also got circumcised a few years ago. So now, I also encountered such stories, you know. Yeah, so now when you go that side, of course, you'll be nervous. So as you go in the operating room, just make sure that you don't look at the wounds. You don't look at the wound per se. Don't do that because ima pangisa mundungana manta. Yeah. Then what happens is ukankana manta, you are going to bleed out so much. Yeah, and it causes pressure. Kuliwaja, you are to process.
Okay, so what is trying to say, to just put more emphasis on it, is that when you are in the operation room, try to avoid looking at how the procedure is going, because you panic, and then when you panic, they say how blood flows in the body is dependent on how the heart beats. So how the heart beats, that's how blood is pumped to all parts of the body. So when your heart is beating so fast, meaning that as they are cutting, you lose more blood. As I am concluding, I'll take one last question.
I was told that if not cut well, it causes erectile dysfunction. How true is that?
Okay, so if not well cut, yeah, it might cause some damages which might be very bad. Because as the way the male reproductive organ is, let me just make an illustration. So you find out that there is a certain line which is down there. Even when stitching around, when they reach at this point, that's when you feel more pain. I don't know if you've noticed for those who have been there. So just at this straight line, that's where most of the tubes pass. So meaning that if they go in too deep, they might cut those tubes, which might cause a damage. So that's why it's done by medical personnel who are trained. And that's why we recommend more you do medical male circumcision instead of the traditional one, which they have said Uganda. We advise medical male circumcision, which is approved by the health system. So as I conclude, guys, it's very important. Male circumcision is a good thing to do, and if you haven't gone there, just make a date, you go there, and it will help you in your health life.